My name is Stephanie Lau, and I am presenting on Expecting Perfection, Prenatal Health and Caloric Quality for the Sociology of Nutrition, Sociology 691. The dietary recommendations for expecting mothers is not to eat for two despite conventional belief, but actually to only increase your caloric intake by 300 calories a day. If you recall the presentation by Dr. Robert Lustig, Fructose 2.0, he mentions that leptin is blocked during puberty and pregnancy, indicating that this is a time period in which expecting mothers will gain weight regardless of how much or how little they eat. The recommendations provided for expecting mothers are actually quite similar to the dietary guidelines and food pyramid in my plate, where they provide a general outline for how to have a balanced diet, but they don't actually help you deconstruct an actual meal. So, for example, if you had a hamburger, how would you break that out into the 5 to 5.5 ounces of protein per day? If you had lettuce and a tomato on your hamburger, how much would that be of the 2.5 cups of vegetables? In addition to the dietary guidelines, you also have a laundry list of nutrient needs that mothers must meet. And this is important to consider because here's where you run into some contradiction. For example, the very last nutrient need, omega 3, can be found in fish. But if you look at our next slide, the dietary restrictions, you will notice that fish is on that list. Dietary prescriptions or restrictions clearly outline specific foods that expecting mothers should avoid. As previously mentioned, some of this may be contradictory to dietary guidelines or recommendations. For example, fish. You are encouraged to increase your omega 3 levels, but you are simultaneously told to avoid fish, specifically raw fish and some fishes such as tuna and swordfish, which have a high mercury level. Now, almost all of the items on this list are actually an attempt to avoid contracting potential foodborne illnesses, and specifically that would be Salmonella, E. coli, or Listeria. Now, in the case of Salmonella or E. coli, contracting either one of these foodborne illnesses, though uncomfortable, will not affect the fetal development. In contrast, Listeria actually could have severe consequences. It's believed that when a mother is infected with Listeria, she actually infects her placenta, and that the placenta continuously reinfects the mother and the fetus, and that the only means to get rid of Listeria if you are pregnant is actually to deliver your baby. So, expecting mothers who do contract Listeria do increase their chance of having a premature birth. Now, what's terrifying about that, though, is that Listeria is not something that seems to follow any particular pattern. These are items that have been recalled in the past by the CDC because of a foodborne outbreak of Listeria. If you look at 2014, you have Roof Foods dairy products. 2013, you have Farmstead cheeses. In 2012, you have ricotta salata cheese. So initially, it may seem like you should just avoid dairies, even though these are not unpasteurized dairies, which is on the dietary restriction list. But if you look in 2011, cantaloupes actually were contaminated with Listeria. So that creates kind of a heightened anxiety for expecting mothers when it comes to dietary restrictions. Not included on this list, but definitely suggested as restrictions are caffeine, well, specifically to limit your caffeine intake, and of course, alcohol. Dietary restrictions or guidelines aside, why is maternal nutrition so important? Well, it's so important because we know it's associated with infant birth weight. Specifically, high pre-pregnancy weight and excessive weight gain is associated with large for gestational age infants. LGA infants are also highly correlated with having a mother who is diabetic or a mother who has developed gestational diabetes. These infants may have an increased chance of birth defects or breathing problems upon birth. And also having an LGA infant could increase your chances of having a cesarean during labor. In contrast, low pre-pregnancy weight and restricted weight gain during pregnancy is associated with small for gestational age or SGA infants. SGA infants may be born with breathing issues, cognitive problems, and they may also be hypoglycemic, meaning that they have low blood sugar. Interestingly, it's also noted that SGA infants may also be obese later in life. In fact, birth weight does seem to have a correlation in general with adult weight, and that brings us to the final point of this PowerPoint, which is the possibility that obesity may be transmissible between generations via non-genetic factors, specifically looking at the maternal environment and maternal nutrition. Sen et al. Conducted a literature review of papers that correlated birth weight and adult weight, and they determined that there is a positive correlation between birth weight and adult BMI, or body mass index. Included in that literature review was a paper by Leong et al., which demonstrated that low birth or high birth weight was associated with increased adult weight and obesity risk. So this goes back to the previous slide in which SGA or LGA could determine adult weight. It was also determined that gestational diabetes has been established as a clear risk factor for offspring obesity. Most of these studies were correlational studies to demonstrate that it is important to pay attention to the maternal nutrition and maternal environment. Another area of research, or specific animal research, has demonstrated that there is definitely a maternal nutrition link between the maternal environment and the fetus. Specifically, that maternal nutrition can affect pathways in the fetus that can increase metabolic dysfunction and increase the risk of obesity in later life. Based on animal experimentation, we have some theories about the mechanisms that may link prenatal nutrition to infant birth weight. It is theorized that prenatal nutrition can affect the hormonal development of the fetus, for example, with leptin. Using lambs and rats, it has been demonstrated that maternal overnutrition results in offspring with an increased adiposity or increased fat percentage and downregulated leptin receptors, meaning that these fetuses or offsprings are leptin insensitive. If you recall the presentation by Dr. Robert Lustig in Fructose 2.0, he describes how leptin is actually a way to tell the body to stop eating because you're full. And if someone is desensitized to leptin, then they don't really respond to that biochemical feedback. Interestingly, these offspring also had decreased dopamine synthesis, meaning that they had less of the feel-good or reward hormone. Inflammation in the mother could also increase adiposity in the offspring, and specifically intramuscular lipid, which is the fat that accumulates in and within and between muscles. These same offspring also generally had decreased muscle fiber development. Offspring of overnourished mothers could also demonstrate mitochondrial dysfunction. Mitochondria is the site of beta oxidation of fatty acids, and this is responsible for energy production in all cells. Mitochondrial dysfunction could lead to the decreased mobilization of fat stores, decreased efficiency of lipids for energy production, and increased likelihood of accumulating lipid within muscle and general adipose tissue. All of these mechanisms point to the role of epigenetics. The study of epigenetics is the study of inheritable changes in gene activity that is not related to the DNA sequence. Of interest is the role of environmental exposure, and in this case specifically, the role of the maternal environment and fetal development. The discussion of previous studies looked at general maternal overnourishment or undernourishment, but if we want to look at the quality of the maternal diet, we can look at some random clinical controlled studies which were done on rats. In two separate studies, rats were either divided into a control group, a fructose fed diet, a glucose fed diet, or in another study, a control group, a fructose fed diet, and a sucrose fed diet. The results, though, were quite similar. Fructose-fed diets were hypertriglycemic, meaning that they had high levels of LDL, HDL, and VLDL. And interestingly, they were hypotriglycemic in late pregnancy, meaning that they had lower than average levels. In pregnancy, triglyceride levels increase steadily throughout the term. So actually being hypotriglyceridemic is an indication of poor health. If you recall the presentation by Sally Fallon from the Western Aid Price Foundation, she discusses the need and importance of cholesterol in maintaining homeostasis. And actually, having low triglycerides could be an indication of having an autoimmune disease or the early stages of metabolic syndrome. In line with what Dr. Robert Lustig would predict, fructose and glucose-fed diets had increased plasma leptin. And again, increased rates of plasma leptin mean that they are probably desensitized to leptin and are not responding to it appropriately. Interestingly, though, fructose-fed rats were still leptin resistant after a fasting period and a subsequent blood glucose test. In contrast, glucose-fed rats actually were able to stabilize after a fasting period. And it should be noted that though glucose is a type of sugar, it is not the type of sugar that we find in table sugar, but instead is the type of sugar that can be found in complex carbs such as pasta and bread. Now we have been discussing female rats or dams. When we look at the offspring or fetuses, fructose-fed fetuses were hypotriglyceridemic, which again is another indication of poor health. And they were also shown to have hepatic steatosis, which is another way of saying a fatty liver. Again, if you recall the presentation by Dr. Lustig, he mentions how fructose consumption can lead to lipidemia or fatty liver disease. So in conclusion, the dietary recommendations for expecting mothers can be vague, similar to our dietary guidelines, and they may be highly restrictive and potentially contradictory to the dietary guidelines, especially if you consider the fact that a lot of the foods that are recommended are to avoid foodborne illnesses that really may not affect the fetus but could just be uncomfortable for the mother during pregnancy, with the exception, of course, of listeria. And interestingly, these do not include prohibitions on high fructose or sucrose products. So, for example, we were told not to have wine or any kind of alcohol. And obviously, the alcohol is not good in terms of potential fetal alcohol syndrome, but then also for the liver, as described by Dr. Lustig in his presentation. But women are told to have fruit juice and are not told to not have or avoid soda. And in both situations, this is a high amount of fructose that a mother may be consuming, which could have long-term consequences for the fetus that is developing inside her. Based on animal experiments and the mechanisms that may link prenatal nutrition to birth weight of infants and health of infants, I would recommend that it also be recommended to expecting mothers to limit the amount of sugar that they have when pregnant.